Welcome to this webinar, Disease Management, an Essential Strategy for Healthcare Reform, and why disease management manuals are your solution. The Patient Protection and Affordable Care Act, signed into law on March 2010, addressed multiple changes to the current healthcare delivery system. Payers are moving into value-based purchasing models using financial incentives targeted at providers, consumers, or both, linked to measures of healthcare quality and efficiency. And we know that underlying all of the healthcare reform initiatives is disease management, which is why agencies need to become turnkey disease management programs, and how you can make disease management programs within your agencies with the use of these disease management toolkits. But first, let's answer the question, why disease management, and why disease management in healthcare reform? Well, the healthcare reform programs of transitional care and accountable care organizations are about improving outcomes and reducing cost. This is accomplished through disease management programs. Disease management programs identify patients with costly chronic conditions such as diabetes and asthma and encourage them to follow recommended self-care and coordinated care regimens. Disease management strategies range from educating patients about appropriate self-care, such as self-monitoring, keeping medical appointments, taking prescribed medications, maintaining healthy diets and exercising, to developing customized plans, coordinating care for patients with multiple chronic conditions. Disease management programs also try to improve providers' adherence to evidence-based care guidelines. Disease management programs essentially seek to improve outcomes and control healthcare costs. So in healthcare reform, we are seeing multiple new programs, accountable care organizations, patient-centered medical homes, value-based purchasing, and more. Disease management is the key in all of these, and home care has to step up disease management programs. The pressure on our healthcare system to deliver efficient, quality, and cost-effective care is increasing. Chronic disease management and home care can together ease many of the present and future pressures facing the healthcare system. Through the use of best practices, home care agencies can become disease management support systems, gaining referrals and market share in this highly competitive market. But what is disease management? Well, in disease management, the focus is shifted away from the treatment of acute exacerbations of disease, instead focusing on prevention and health promotion. The avoidance of unnecessary hospitalizations and emergency room visits is really stressed, and it's all about self-care efforts and patient empowerment. There are several components of disease management. We have population identification, risk stratification, evidence-based guidelines, patient self-management, and expert clinicians. Disease management is based on this new model of healthcare reform called the chronic care model. In the chronic care model, healthcare organizations are looking to have active, informed patients who have productive interactions with their proactive practice teams in order to have good functional and clinical outcomes. The disease management model also incorporates the best of the best. It is really a continuum of care. We find preventive health strategies such as prevention and screening programs, and patient education and patient empowerment become huge components of this model. Research has shown that an empowered patient can and will make changes, and although we still have some reactive health care in this model, it is reactive to the changes in a patient's clinical status, such as changes in weight in a CHF patient or changes in blood glucose in a diabetic patient. But the main focus is on disease prevention and health promotion, which fosters predictive health care. So how can you develop a disease management program? Well, it's easy. At Innovative Healthcare Solutions, we have created them for you. We have developed 3 disease management manuals: cardiac, pulmonary, and diabetes. In these manuals, you have everything you need to develop a turnkey operation over a very short period of time. Here is an example index. You get all the ideas and forms you need to start a program in your agency. From assessment of your agency and staff, to telehealth material, to risk stratification, and education of staff and patients. Let's take a closer look at some of these. One of the big components of disease management is agency assessment and patient assessment. We know that more than any other segment of healthcare services, home healthcare practitioners are uniquely positioned to address the challenges and capitalize on the opportunities to ensure that chronic disease patients and their caregivers do not fall through the cracks. Home health care is the component of the healthcare industry best positioned to bridge gaps in care between hospitals and homes. But in order to do so, they must adopt disease management principles for high-risk diseases like CHF, diabetes, and COPD. But we have to take a look at what we're currently doing in our agencies. So, it's very important that we do a SWOT assessment. What do we include in a disease management program? Well, before you start, you need to assess your own agency and to assess patients for population management. We have given you many wonderful tools that are state of the industry. This tool that has been developed for you by the McCall Institute for Healthcare Innovation. It is basically an assessment of chronic illness care. It is to be used by your team to identify areas for improvement in care for chronic illness before beginning quality improvement work, and to evaluate the level and nature of improvements made in response to quality improvement interventions. It's a practical assessment tool to guide your agency through the planning process. The results can be used to help your team identify areas for improvement. It looks at your agency's leadership, quality improvement efforts, delivery system design, and other components needed for chronic illness care. We also give you multiple tools for patients. This is an example of a tool for diabetes from the University of Michigan, a research-based tool for diabetes foot screening, just one of the many tools you will find in this manual. Here's an example of a learning needs assessment for COPD. We have similar types of learning needs assessments that are research-based in all of the disease management manuals. And of course, a complete physical assessment tailored to specific diseases are essential. All of the manuals come with complete physical assessment forms that you can use as is or incorporate into your documentation system. As we talked about the chronic care model, we talked about prevention. You need to show your referral sources and payers that you understand screening and that you can hold screenings. In all the manuals, you will receive important health screening information. Oxygen safety is important in both cardiac and pulmonary. Again, simple tests like this oxygen therapy quiz can be easily utilized either on-site in homes or at prevention screenings. Another important component of disease management is competency assessment of staff. Let's face it, we just don't have our fingers on expert clinicians for all our disease states, so we have to train our staff. We give you all the tools, the competency assessments, and quizzes to get you going overnight. All manuals come with suggested curriculum for cardiac, diabetes, and pulmonary training sessions. These can be easily used in an all-day staff training with physicians as guest speakers or pharmacists. We have put the curricula together for you to take the guesswork out of what needs to be taught to make your clinicians experts in their field. From respiratory tests based on the curriculum to cardiac rhythm testing to diabetic questions, it's all here for initial training and ongoing yearly competency assessment. And no diabetic program would be complete without instruction on pressure ulcers. We know how important that is for OASIS-C and outcomes. It's all here in our Diabetes Disease Management Manual. And once you teach, you have to validate. We have given you the validation tools you need for that initial validation of your clinicians as well as ongoing validation. All you need to do is put your agency name on these tools. Cardiac training includes rhythm testing, and let's not forget IV diuretic administration. If you're doing it, here is your competency tool. These tools can also be used in your marketing to show your referral sources that you hold your clinicians to high standards. Similarly, a COPD program wouldn't be complete without spirometry testing. We tell you what you need to teach and then give you the tools to validate your staff to put in their files. Another disease management component is risk stratification and inclusion criteria. We have gone to the evidence and done all the work for you. We know how population management works. You need to know from the research who gets included in your programs and how to stratify interventions based on those low, medium, and high-risk patients. We went to the experts and put it all down in simple table formats. Our risk stratification is based on predictive modeling that shows statistical probability for hospitalization and mortality. It should come as no surprise that blood glucose levels are the hallmark of a risk stratification program for diabetes. HbA1c values within normal range indicate a low-risk patient. Those with HbA1cs between 5 and 8 are at medium risk. Anything greater than 8 indicates high risk. Any amputation, increased number of hospitalizations, or end-stage renal disease would also make the client at high risk. For cardiac, we show you how the New York Heart Association classifies patients. So once again, we've gone to the research and we've taken the guesswork out of it for you. And simple tools like this one with stop signs show your admission nurses who is at high risk and who should get front-loaded visits, and telehealth. So these become your telehealth stratification tools to get the boxes off your shelves. Low risk, medium risk, high risk, the same measures the physicians use. The difference is that they don't visit patients or control the telehealth. But with these tools, you can risk stratify and individualize your interventions for your patients and wow your referral sources and payers with your knowledge. Looking to partner with an accountable care organization? This will show your expert knowledge. Then, based upon their risk, they're placed into a program that incorporates home visits with telephone and telehealth. And we give you the grid. We have put hundreds of hours into our programs. They are proven and effective. Disease management also requires telephone and telehealth management, and we have many tools in each manual to get your telehealth program up and running. So in a disease management program, you have to identify the population, but next you have to stratify according to risk, implement your interventions according to risk, and of course, evaluate your outcomes. Look at how easy it becomes when you have a tool like this. Do you have telehealth boxes sitting on the shelf? You won't if you use these tools. In disease management, we know that our patients have many problems. There are other comorbidities involved. This comorbidity index makes it easy for your clinician to see what risks are involved and whether or not the patient needs telehealth or telephone visits. And of course, CMS says we must standardize our telephone calls to our patients. All the manuals come with outstanding telephone questionnaires that are based on evidence and are outcome driven. The clinician asks a question, the client responds yes or no, and the decision tree tells the clinician what needs to be done. It's that easy. Standardized patient education is key in any disease management program. Now, with meaningful use, facilities and providers need you to standardize education and partner with them in their collaborative programs. In the new CMS Care Transitions programs, we now have red flag alerts. One of the pillars is that patients know signs and symptoms of disease exacerbation, who to call, when to call, and what to do. Not to worry, we have it all covered for you in this amazing tool. The stoplight tool. Our stoplight tools are the answer to red flag alerts. Based on the Institute for Healthcare Improvement Zones for Management, patients and caregivers know what zone they are in and what to do. These tear pads are colorful and you can put your agency name on them. They follow the plain language guidelines and everything CMS is looking for in good patient education. They will set you apart from your competitors. They will open many doors for you as you market your disease management program. This modified Borg scale is evidence-based and a best practice for the control of dyspnea. It will help improve your overall dyspnea scores as patients learn how to rate their dyspnea. And no diabetic disease management program is complete without a sick day plan. We have it all covered for your agency. You will receive a paper manual and the CD-ROM so that you can easily download all the great patient education forms and tools and customize them with your name. From teaching records to goal setting, we know what's in it in patient education and we promise you won't be disappointed. Why create them yourself? We have expert clinicians who have compiled the best of the best and put it together in one cardiac, diabetes, and pulmonary manual. It's all here. It's a turnkey operation. Now all you have to do is hire the staff. Why pay your clinicians to create a program when our clinical nurse specialists have done it for you? That's right, created by clinicians for clinicians, based on research and evidence. The concepts of the disease management manuals are also included in healthcare reform webinars that are available for purchase. But just through the purchase of the disease management manuals, you will get ideas and all the necessary tools required to help you start a disease management program. The CHF Disease Management Program also comes with a PowerPoint that you can easily use to market your program. All you have to do is plug in your own agency specifics. Disease management is an opportunity and a necessity. Home care must assert itself in the role of disease management and transitional care. And home care is uniquely positioned to effectively address transitions and outcomes in the community for a growing population of older adults with continuous complex needs. Transforming your agency by adopting disease management will bring in new referrals and make you the preferred partner in transitional care, accountable care, and other health care reform initiatives. So call us at 630-236-4603. We also have webinars on how to create these programs based on these wonderful manuals. So you can start tomorrow by calling us today for your CHF, diabetes, and COPD disease management manual.